You know, there's another product in our armamentarium called Evusheld, and this is given to prevent COVID infections, but it's only for a select group of patients. Can you talk a little bit about Evusheld?
Yeah, so Evusheld is a combination long-acting monoclonal antibody that's given by intramuscular injection, 2 different shots. Evusheld is officially FDA authorized for people who are very moderately or severely immunocompromised. And I'm not talking about an 85-year-old man with obesity and diabetes. I'm talking about roughly 3% of the American population, transplant patients, those on lymphocyte depleting medications like Remicade, those with IgG subclass deficiency, really those who are immunocompromised. And really, if you think about those who have been really living probably in the most anxiety during COVID, it's been that population. So in the clinical trial for Evusheld that got an FDA authorization, what they measured was COVID infections over a 6-month period. And it decreased COVID infections by roughly 80% in those who received the Evusheld product. So at Ohio Health, we are really prioritizing giving it to people who are immunocompromised. Now, please keep in mind, as everybody knows, we still vaccinate those people. In fact, those are the people who qualify for 4 doses. If they get an mRNA vaccine, they get 2 doses, followed by a 3rd dose, at least 28 days from the 2nd dose, and then 5 or 6 months after that, they would qualify for a booster dose. So we still vaccinate those people. Since this is a scarce resource, we are asking providers to document that the patient actually have a negative spike protein IgG. Immunocompromised people, we still vaccinate them. If they respond to the vaccine with a measurable spike protein IgG, we would deprioritize them, and we would just ask that that patient have a repeat spike protein at 30 days to see if they eventually qualify. Again, I ask for everybody's grace, understanding, and patience. There's a lot going on in this.
Yeah. Thank you, Joan. A lot of complexity associated with some of these therapeutics and treatments.